South Africa has a massive burden of disease.
South Africans are marching to their graves.
South Africa is the epitome of HIV, for example, and yet for intellectual generation, we depend on foreign people where the disease is not a problem, do research and come and inform us what to do.
We're very concerned about the lack of PhDs or medical doctors who become PhDs and grow clinical science in South Africa.
When people do research, they do research to answer the problems not only of South Africa, of the public sector, but the problems of the world.
Building a comprehensive healthcare system in a country as complex as South Africa requires all hands on deck.
We've got a clinic here, but even the doctor, there's no doctor. We struggle.
We have currently 8.3% spend of our GDP spent on healthcare, but that 8.3% actually had to take care of 84% of the population. So there can never be enough resources.
This in a country facing a quadruple burden of disease.
In fact, I describe them to people who are not in health as 4 highways through which South Africans are marching to their graves. And I said the biggest highway is that one in which people with HIV/AIDS and TB are marching.
If I look at the small area that I grew up, and I look at how many funerals we used to have in those days relative to now, clearly you can see the numbers increasing quite substantially.
It's clear that we need more doctors.
Without healthcare human capital, you can't address the healthcare challenges we face as a nation.
The ability to work together collectively as a private sector, number one, and the ability to work with government, number two, is a crucial aspect to trying to build a comprehensive healthcare system.
The concept was for major players in the health industry to pool a percentage of profit into a central fund.
The process of getting all of the private sector companies to work together was a complicated one, and I suspect that herding cats would have been easier.
By 2010, 22 companies with competing business interests found common ground, signed a social compact, and established the Public Health Enhancement Fund, which supports 3 key projects.
3 areas that we really looked at was bringing more doctors, creating more PhDs and masters. PhD masters were in HIV, AIDS, and TB. And the third area was we put money towards the Leadership Academy to create more public administrators within the hospitals.
Many times we set objectives for ourselves, but it's not tangible. These ones are very meaningful to a lot of people, and the outcomes are quite clear in terms of what we want to achieve.
The basis that has been set provides so much hope and possibility to do something actually bigger.
Can you imagine 1,000 people sitting there under one roof, having got their PhDs in research on HIV, AIDS, and TB, and saying this is what we have created for the country? That's something to marvel at. Or looking at the number of medical students, to say these students here who are now doctors, we have got so many extra doctors who would not have existed if it was not because of this fund. You know, it's something to be very proud of.